So testing is a big topic nowadays, especially the fact that the new news release. We're ramping up. We're ramping up. We know more people are going to come for testing, especially that now we're testing all symptomatic people, even with at least one symptom, and even asymptomatic people who are concerned they have been exposed to COVID-19. So definitely the testing centers are ramping up, appointments are being booked, we're expanding hours. So we're looking forward to the increased testing, and we're trying to be, we're getting ready for it.
So you are clear on who you will be testing. You know exactly anybody asymptomatic who's had potential contact, anybody showing even one symptom. But as we've been reporting, and as others have been talking about too, there is a lot of confusion over the messaging over who really does need to get a test. And I'm wondering, are you seeing that in the patients who are showing up? They're not quite sure. I mean, is that playing out at all in your experience, in your surroundings?
So from what I see is if you're concerned because you've been exposed, then the public health had made it clear that people who are at risk of exposure through their employment or risk of exposure through the contacts they've been with can get testing. So if you're concerned, then definitely call your testing center, check online on your nearest hospital's website about how to reach your testing center, or call your public health number, and I'm sure someone will clarify. Absolutely. There's no reason for people to be confused about this because, as soon as something comes out, like an announcement comes out, I'm sure the first few days there's a bit of confusion, but we would love to clarify. So please contact us and we'd love to clarify.
Testing has been an ongoing issue in Ontario and a problem. The numbers have lagged, and there's been a lot of call to do far more to get a sense of how widespread the disease is. And still, on this day, I think it's 77, 76 of the pandemic, not up to capacity. How concerned are you for the future, as somebody who works in this, surrounded by this, right in the middle of it, if the province doesn't get a handle on testing?
I think the point of testing now is to basically find out what the hotspots are. Right, Heather? So we're trying to find out what the hotspots are, and the more knowledge we have, the more power we have against this virus. If we know how the hotspots are happening, how we can protect the people there, then that's how we can actually fight this virus. So yes, we're ramping up testing, but we're going to get there. We're working on it. We're working with public health, and in terms of the capacity for testing, it's going to have to happen. It's going to have to happen, just like other countries have been able to ramp up. Hopefully we're going to be able to do it as well.
It's interesting you mentioned hotspots. We had a comment from one of our viewers, always taking viewer questions and comments, Kathy Orr, writing to say people in Ontario would like to know exactly where the spikes are coming from in Ontario with these new cases of COVID-19. So looking for the hotspots, and I was just saying in introducing you, Doctor, that vague areas, but no real definition of where the hotspots are in the province for the people of Ontario. Would it be helpful to know?
I think it would be very helpful to know. First of all, a hotspot is anywhere that there's a lot of crowds. But right now, with the expanded testing, we'll be able to find out what the hotspots are. And I think that is the most relevant data that's going to be coming out of this. So I think very soon into the future, now that we've started increased testing, we'll be able to find out what these hotspots are and why they are happening. I think that's where we're at, is why are we having these hotspots?
And certainly that's a question that we're hearing from viewers too, wanting that transparency, that accountability, where they are and why they are, so we all know, get that full information that the province promised. You were among the first to raise the issue with us weeks and weeks ago about your concerns for the ER. The people were so worried about COVID-19 that they weren't showing up in the emergency room with other really serious medical issues. And indeed, there's been a lot of studies since, a lot of data that's come to the fore that says that's exactly what has been happening. What are you seeing now?
I'm seeing volumes going back up. I'm seeing them inching back up. Not necessarily only COVID, but I think people are getting the message that the emergency department is safe to be in if you're having an emergency. Please don't ignore that crushing chest pain, that shortness of breath. If you're unsure of your symptoms, speak to your family doctor or speak to telehealth and get some more information as to whether you need to come in. We've taken all our precautions to be able to serve you, our community, and so please don't be worried about going into the emerge if you need it. So what I'm seeing is people are hearing that and they're coming in for their serious symptoms, but we also have people that are still fearful. I have colleagues, and the people who would, and the professionals who would know this are the family doctors. My colleagues who are in family medicine are urging some of their patients to go into the emerge, and they're still fearful about it. So yes, I'm seeing it itching up, but there's still people fearful about it. And you've got the other extreme, where I hear people tell me in the emerge that, oh, I heard the emergency department is not busy, so I thought I would come in. And so we've got two ends of the spectrum here. But most importantly is if you feel like you need medical attention, if you're having serious symptoms, please come in. And if you're not sure, ask.
That's such good advice, because it's been worrisome, hasn't it, to hear stories of people, experiencing potential cardiac issues and just are reluctant to go in because they think it's not a safe place to be in the hospital, even though they have a serious medical issue. So at this point in all of this, I mean, you sort of gave a little bit of advice there, but what's your message as you continue to follow this and be in the thick of it, Dr. Khatib? What's your message to people right now?
My message is physical distancing. It's still, if we go down to the basics, that's still the main way you can protect yourself and protect others. My message is, let's try not to be selfish. Let's start thinking collectively and think of the immunocompromised neighbor, our grandparents. Think of all these people who are more likely to be affected. And just because you might be younger, it doesn't mean you're immune to this. So please, seeing a lot of people in the park, seeing crowded areas, to me, it's a disappointment to the generation who is the reason we live in the Canada we know and love. And honestly, it breaks my heart to see crowded areas like we saw on TV a couple of days ago. And hopefully this, the message is now clear to please respect physical distancing. I think the message at the beginning was that, and the message will always be that.